So I am representing the Hong Kong Society for Rehabilitation and my colleague, Mr. Ng Han Sao. Mr. Ng apologizes for not being able to come today. I myself, I know I don't look like a Hong Konger, but I am. I have lived in Hong Kong for 38 years. And all of that time I have worked with the Hong Kong Society for Rehabilitation. And it's all very well to share my screen, but I can't make it go down. So, you know, Hong Kong is a very small place, actually, with a very big population. And we have a very fluid boundary with China. So when the epidemic first emerged, or when the cases first emerged in Wuhan, the Hong Kong people, based on the experience with SARS, which was a very bad experience in 2003, immediately started to buy masks and use gloves and wash their hands without having to be told by the government, actually. We actually now talk about we have had 3 waves. So the first wave was a small wave in January, February, and all of our borders were closed by the end of February. And then the second wave was many students coming home in March and residents coming home. And then we were actually decreasing our social isolation and opening up. And then we had our third wave start in July. And we are just coming to the end of that now and just beginning. Our students will go back to school next week. And we still only can have 4 people eating together, but we are doing much better now. So difficulties faced by people with disability, I think that everybody has already mentioned them. These difficulties were raised by disabled persons organized NGOs. We had a meeting at the end of April to collect all the different views and to report to government. So people with low vision and blindness, for people with mobility impairments and people with hearing impairments, touch is just so important. So we have already talked about that a lot. But people with hearing impairment also talked about the issues of hearing aids and microphones and keeping things clean. In Hong Kong, because we immediately went out, everybody bought up all the masks. So there was really a competition for masks and sanitizers. So that was a really big issue. And lots and lots of hygiene measures were done, but many of them, people with disability were unable to locate. They weren't, so there was not an inclusive approach or universal design approach by the general public. There was some mixed messaging because of the government wanted us to use our elbows for coughing and sneezing, and that created problems for some people with disability. And actually the Hong Kong Society for Rehabilitation, the vast majority of our service users also have chronic disease. And we really very, very pay attention to the fact that there was amazingly, very much increased anxiety, not for the vulnerability, but also because they've delayed treatment and not wanting to go to the hospital or their appointment being stopped because the hospitals just really focused on COVID without, and other people got a little bit left behind. Crowding on public transport. We didn't actually have lockdown in our homes. We were just advised to stay at home. And so many people were still going to work. So that was a big issue for people in Hong Kong. Crowding, like other Asian countries, is a major issue. And then, of course, the last problem is loneliness and stress, which everybody has talked to. And here in Hong Kong, we have some evidence that the people with disability have experienced increased loneliness, and it was reported by them that they really suffer from depression. Loss of jobs is another major issue. The messaging on prevention and actually what was happening and what the government was done was not available in multiple accessible formats, as been noted by all the other speakers. And actually just today I contacted a friend with hearing impairment who told me that still only we have sign language on the news at 7 p.m. So we have some, we all have some work to do there. children with disabilities who are out of school, both those who are in special childcare centers, early child development, and also those who are in inclusive education, had a lot of issues. There were complaints about having to compete with siblings for online classes, and or only have telephone and don't have computer. And you know, Hong Kong apartments, Hong Kong living spaces are extremely small. And so this was very difficult. And teachers, of course, were very stressed out with having to use the new methodology themselves, and they neglected the children with disability in their classes. Our elderly homes have been closed to visitors since February. And so social isolation is a major problem. In fact, until this third wave, until July, August, we didn't have any cases in elderly homes, but now we have many. But anyway, they haven't been able to have visitors since February, and this is extremely anxiety producing, especially for those elderly with communication abilities, disabilities and dementia and other issues. And then our teen camps were not accessible. They basically lacked universal design. And even more recently in the summer, we have built a temporary quarantine camp and a temporary hospital. And only latterly, because of having to quarantine people from elderly homes, has the government began to think about making more universal design. I think all of these things have already been mentioned. You know, we have people with intellectual disabilities who have to stay at home and lose their daily routine and social communication. People with difficulty to follow online classes. Hong Kong, very small living spaces. I don't know if you know, we have what we call caged homes, where people actually who are in poverty, they live in a bed and have a cage around it, or they live in subdivided apartments with can be reasonably big families sharing one apartment, and very small. And so those people had really a lot of struggle. And of course, a lot of those people are very poor and don't have good social networks to begin with. And I think a very interesting point that was brought up in a consultation meeting is that the disabled persons organizations really worked very, very hard, and are now working very, very hard to look after their members, and also all the NGOs in Hong Kong, most of the services provided by NGOs, the day-to-day services, and worked very hard to look after their members and their service users. But in fact, not everybody, every person with disability belongs to a DPO or an NGO, and those people have fallen through the net, and this is a big issue. The government, as has been reported for other countries, has gone through a series of measures. In Hong Kong, everybody who has a positive infection goes into hospital. And all contacts are put into special quarantine facilities. So you can understand why the issue of inaccessible quarantine facilities is quite major. And that maybe goes back to our Hong Kong's disaster planning, that we have not had people with disability involved enough in the government disaster planning and for things like quarantine facilities and so on. The government also immediately put in a lot of different operational guidelines for the elderly homes and for homes, but also we have the same problems as were discussed in Korea and Japan, and that when the homes closed down, there were no face-to-face visits, so isolation. Carers had to look after their own children, so the decreased number of staff members. In Hong Kong, as in some other countries like Canada and Australia, some of the workers in elderly homes work in 2 or 3 different homes. And so they can carry the infection, which is what has happened most recently in the last 2 months between homes. The home care services were decreased, but anyway, the government did provide a lot of different financial supports to the whole population, and specifically to people with disability, and specifically to people in poverty, including support for some social enterprises, so that the social enterprises were able to apply for the regular funds so that they could keep their staff on instead of making them redundant. So that was good. Just in response to one of the issues about the massage, one of our DPOs, the Hong Kong Blind Union, actually came up with the idea of asking people to purchase massage coupons, which can be used once the social isolation issues are decreased. And so people were able to get a little bit of money in and early on in March and April and May, but they will still have to give the massages, of course, in October and November, but this was one response. One of the other big issues we had was how to deliver medicines. And in Hong Kong, we are not very advanced in e-health or in telehealth. And there was, in February and March, there was a lot of discussion about whether people with disease could get their medicines without seeing. Quite strongly resisted that they would first have to come and see the doctor. But of course, people with chronic disease didn't want to go to the hospital. And we also had this issue about how to deliver medicines to some of our elderly people who live across the border in China. So that was quite, that took a time to negotiate, but it is now solved. For the Disabled Persons Organization and NGO contributions, I think I've already reported quite a few. They really worked extremely hard. Lots of donations, of course, and also counseling and seminars. As an example, we have an organization called Direction Association, which is formed by people with quadriplegia, and they distributed masks and disinfectants to all their members. But then they realized that many Hong Kong people were queuing up for 2 hours, and there were many elderly people in these queues, and so they started to also support them and help them. And so there are many stories like this, and I won't stop you anymore, but I think some of the key things for Hong Kong is how to become more involved in the disaster preparedness plan, how to have more interprofessional education, so with our hospitals, which maybe should be, and the architects and also all the government departments about the needs of people with disability. And also we have a feeling that the government was not proactive enough, that somehow the voice isn't strong enough. And actually in Hong Kong, we have last year starting to establish a new organization, a Disability Council, which we hope will improve this situation. So thank you very much.